Today, we take our advanced public health for granted. We don't think twice when we put our trash out one day and it's gone the next, or go into a clean public building where there is no smoking. When doctors keep our health records, we don't realize that this information is used to keep track of the public's overall health. This is in order to create better public and medical standards that would keep us healthier and away from illness, such as flu shots being advertised during the winter when the number of people with the flu are on the rise. In Lemuel Shattuck's time of the early 1800s, there were no rules or regulations on keeping the city clean and its people healthy. Shattuck believed that advancements in public health and sanitation would prolong the lives of everyone.
Lemuel Shattuck can be called our very own hometown hero. He was born in Ashby, Massachusetts in 1793, later lived in Concord and then Cambridge, where he made his most famous advances in public health. In his early life, Lemuel was often ill, which pushed him to stay close to home and take part in civil affairs. Shattuck also had a somewhat irregular education. He was even homeschooled by his older brother for a time. At the age of 20, Lemuel went to work as a shoekeeper with his brother in Concord. Shattuck also worked as a teacher in New England for some time before quitting and joining the school council committee in Concord. While on this committee, Shattuck introduced a system of registering children and coming up with school data reports to be accessed by the public, a practice never done before. A little over 10 years later, Lemuel moved to Cambridge, Mass., where he became a bookseller and publisher, as well as a member of the state legislature. While in this legislature, Shattuck introduced a process of keeping records of births, deaths, and marriages that would eventually become the model for many other states in the Union. Shattuck had an interest in statistics that influenced his later work in public health as he realized that data could help bring about important reforms.
Before Lemuel Shattuck's advances in the 1840s, sanitary conditions in the city of Boston were only vaguely addressed by city services, and health records were sparsely taken. Sickness and death were very common. The citizens of Boston were used to disease and death, and before Shattuck there were no clear records of the effect disease and death had on the population. Without statistical data, differences of opinion on the magnitude of death and diseases were common.
Recognizing that statistical data could aid in establishing health reforms, in Boston between 1811 and 1839, Lemuel took records of diseases such as cholera, croup, dysentery, and whooping cough. Shattuck made many observations of the public health over the years. As he stated, an amount of sickness which formerly would have thrown the whole community into a state of consternation may now occur as an ordinary event and elicit no special attention. This shows that the average citizen of Boston had become so accustomed to disease, they saw it as a part of their normal life. Many doctors, legislators, and townspeople thought public health was getting better and people were living longer due to different modes of living, the increased medical skill, and other causes. Shattuck's statistics helped him to deny some prevailing beliefs of Boston's improving health, stating that on average clergymen have actually lost 7 years and physicians 9 years. The false hope that public health was improving was proven wrong with Shattuck's statistical approach to change.
Because of Shattuck's statistical background, he used data to make claims on how to improve public health. Written in 1850, Shattuck's report made for the Massachusetts Sanitary Commission, known as the Shattuck Report, regarded recommendations for the state of public health in the city of Boston. Shattuck had strong beliefs in the usefulness of taking records of people from the day they are born until the day they die for the benefits of public health. He states, "We have already said that an accurate knowledge of the living inhabitants of a place forms the first element for the estimating its sanitary condition. An exact knowledge of the births, marriages, and deaths forms the second essential element. Without both of these elements, we cannot determine with any considerable degree of accuracy whether the public health at one place is better than at another, or whether at the same place it is better at one time than another. By them we can determine both of these propositions. In other words, the two main ideas he targets are that there should be a record of everything that happens that could be related to public health, and that there needs to be knowledge about public health. This statement is the basis for many regulations he suggests within his report and the root of his ideas.
He lists 50 specific regulations that he believes will better the public health of Boston. Some focus on how to make buildings and cities more sanitary by recommending that the structures and appliances be regulated and monitored. He also recommends the creation of a Board of Health and that the information they gather on Boston to be spread to the people yearly. Shattuck believed in the transfer of information and knowledge, and he knew that it would help reduce the prevalence of disease and sickness in Boston. He also recommended that people are educated in disease and sanitation, and that they use this knowledge to educate the public. Within the 50 specific examples, Shattuck was always focused on the idea of gathering information and data and using it to improve public health.
Shattuck knew that the public would not willingly accept his new ideas, since citizens of Boston were not too worried about the sanitary condition of the city. They had become accustomed to the unsanitary conditions, as it was a part of their everyday lives. He listed reasons on why his report should be validated. It was a practical, useful, economical, philanthropic, and moral measure which the progression of age demands. His recommendations targeted people from all areas of life because he knew the condition of Boston affected the health of everyone who resided in the city. He knew that people would have arguments against his work, so he provided reasons to why they should accept his plan and how it would be effective. Finally, Shattuck recommended a bill for the state legislature with guidelines to improve the overall public health of Boston. Some of the main points were to create a general board of health, have a budget for education of the public, keep track of diseases, and create state regulations based on health and sanitary discoveries made.
Shattuck died before any of his measures were acted upon, and his specific bill was never passed. Although his report did not have an effect immediately, in the long run, it contributed to an increase in public health awareness in Boston. It brought the idea of changing the way medical records and disease reports were taken for the public and make the health conditions easy for the public to understand and the government to improve.
In 1864, Boston City Hospital was opened. The State Board of Health, considered a comprehensive and modern state health department, was established in 1869. Shattuck's revolutionary report changed the way public health was looked at in Boston.
Almost all of the ideas set forth in Shattuck's report are currently enforced in Boston. Now, all deaths, births, and marriages and disease are kept on record. Like Shattuck suggested, this information will help the city in making decisions on what to change within the public health. Boston has a state sanitation codes, which are a set of regulations developed by the Massachusetts Department of Public Health to protect the health, safety, and well-being of occupants in units and the general public. These codes are enforced by the police, and people are punished if they do not follow the regulations. For example, every household is required to have a fire alarm in multiple rooms of their home. This law was created because house fires became a real issue, and based off of the records, the state realized that it needed to be created into a law. Shattuck brought this idea of making change based off of statistical data received. Deaths caused by house fires led to the passing of laws that required fire alarms in homes. Public health is something we take for granted in the 21st century, and it would not be at the current state it is now without people like Shattuck thinking ahead to the future.
Lemuel Shattuck may not have discovered the cure to any diseases or even practiced medicine on patients, but he did revolutionize the practice of keeping health, population, labor, and school records. These records set up a model for many other states to follow and be used for centuries to come. From growing up in Massachusetts to later serving on the state's legislature, Shattuck has achieved a variety of things, including writing and publishing books, conducting town and statewide censuses, and documenting births, deaths, and marriages. Lemuel Shattuck's beliefs in the improvements of public health, which also included a plan for establishing better schooling for nurses, is remembered today with a hospital built in his name in Jamaica Plain, in Boston, Massachusetts,
where his improvements in the healthcare industry are practiced every day. Lemuel Shattuck was an intelligent man whose plans and improvements changed the way healthcare was perceived by professionals and the public, and his name should be credited with these accomplishments and never be forgotten.